Established in the year 1982, Jilichem Laboratories India Limited produces all major categories of medicines and have a strong presence in the Indian pharmaceuticals market.
Having 2 production units at Vatva and Adana on the outskirts of Ahmedabad, and the third one at Daman and an office overseas to look after exports, Jilichem Laboratories has a track record of manufacturing the best quality medicines. Equipped with ultra-modern manufacturing facility, it prepares a wide range of products such as powders, tablets, capsules, liquids, injectables, and all forms of ointments.
While liquid manufacturing is carried out on fully automatic production line, class 100 atmosphere is maintained by sterile shower facility in the injectable section, so that injection vials are filled and sealed in completely sterile and aseptic condition to get superior products.
The capsule filling machine has a capacity to produce 38 crore capsules per annum. Simultaneously, 105 crores tablets of various shapes and sizes can be manufactured on the compression machines.
Supported by laboratory trials and experiments, each step of manufacturing, right from testing of raw materials to packing, is subjected to strict quality control to provide our consumers products as per international pharmaceutical standards. The pyrogen and toxicity section under quality control take due care so that the products coming out of the plant are sterile and toxicity free. The products manufactured here are handled with great care like a newborn baby, and these materials are made to pass through stringent quality ratings.
Jilichem houses the most modern sophisticated instruments for superior quality assurance as well as research and development work. The prestigious list of instruments include high-pressure liquid chromatography, infrared spectrophotometer, and UV visible spectrophotometer.
Having established its position in the pharma manufacturing and marketing, Jilichem Laboratory now enters the field of emergency medical care by manufacturing and marketing self-care kits, a concept which translates "friend in need is a friend indeed" into practice.
Self-care is aimed at 2 aspects leading to better and faster health and/or treatment levels: primary treatment and body treatment.
The word emergency strikes terror, a terror that denotes helplessness, anxiety, and fear of death.
Sound of a piercing horn or a sight of an ambulance heralds emergency. The emergency sometimes could be so dire that a delay of a second or 2 could mean the difference between a minor and a major trauma or a life and death. Some help has got to be given during this tiring time before a doctor or ambulance arrives. So this first assistance which a victim or injured person is given is known as first aid.
We have seen what is first aid. Now let us see what is the purpose of first aid. To preserve life, to institute life-saving measures, to prevent further injury, and finally to help and promote recovery. Suppose you happen to be in a situation where the first aid is urgently required. What will you do? First, try to understand and assess the situation. Make sure there is no further damage to you or the casualty. And be calm. because your calmness and confidence will help you to deal with the situation more efficiently. Simultaneously, call for an ambulance and make arrangement for treatment in hospital.
The question is, what is it that you require at the time of first aid? The most important thing is commitment to help somebody who needs your help most, along with confidence and presence of mind. You should be able to improvise and use whatever is available. And above this, a first aid kit is a must. The first aid kit contains the dressings, the bandages, a torch, antiseptic solutions, cream, primary drugs essential at the time of emergency, along with various types of bandages.
One of the most common emergencies that we come across is traffic accidents involving one or more persons causing different types of fatal situations.
When you are on such accident sites, please do not smoke, for it can cause fire due to spilled petrol and chemicals. If there is more than one injured person, remember, the most noisy victim may not be the one more injured and critical. First, attend to the unconscious victim. In case some other person is around, send for the ambulance.
एक काम करेंगे क्या एम्बुलेंस को फोन करना जरा अच्छा अभी आता हूं जल्दी हाँ
Check the breathing and pulse of the unconscious person. But how do you know that the casualty is breathing? Look, listen and feel. In case a self-care kit is available in the vehicle or somewhere nearby, use the cotton piece from it to clear the mouth of the casualty and place an airway to help breathing.
In normal conditions, the breathing of a person is undisturbed. However, in the case of casualty becoming unconscious, the tongue may fall back, blocking the air passage, and the swallowed vomit or dirt may also stop the air entry to the lungs and disrupt breathing. In this case, introduction of an airway to the mouth and throat can open the block and re-establish breathing.
If the casualty is unconscious, it is very important to establish ABC of first aid, that is, airway, breathing and circulation. If the brain does not get oxygen for 3 minutes, severe brain damage can occur.
How does one establish ABC?
First of all, clear the airway. Keep the head back and the mouth open. Close the nostrils. Inhale and blow air into the casualty's mouth until the chest rises. Give 9 such full breaths. If the heart is beating, continue with 10 breaths per minute. Once the breathing is established, check the pulse of the carotid artery that gives blood to the brain.
For pumping of the heart, kneel beside the casualty, place both hands straight together on the breastbone. Press 1 to 1.5 inches and release, with the hands still on the chest, and check the pulse.
Whoever has gone to call the ambulance must return to inform that the ambulance is on its way. Now the condition of the casualty has to be made stable. Holding the hand and leg, turn the casualty over if necessary, so that the hip and legs are at right angles to the body. Tilt the head and check the airway. Now straighten the other arm and place the upper arm at right angle. Now the casualty is in the recovery position.
If one is alone, leave the casualty for calling the ambulance, only after taking these preliminary steps. It is important to give all details like the number of the persons injured, their possible age groups, and other details about the accident site. Put the receiver down only when the person on the other side puts it down, for he may need more details.
A fracture means a broken bone, and fractures are now increasingly common as a result of road traffic, industrial and domestic accidents. The fractures can affect the limbs or the skull and the chest. And in the case of skull and chest, it is important to recognize the internal injuries to internal organs rather than to those of the bones.
There are a number of emergencies where quick help and treatment is required. Fracture and bleeding is very common in accidents. A fracture may be caused by a direct or an indirect force. There are two types of fractures basically, open fractures and closed fractures. Since bones have important blood vessels and nerves lying alongside, a case of fracture must be handled carefully.
Open fractures where bones are sticking out need great care. Support the hand and put a piece of gauze over the wound. Use materials like magazines or newspapers as support. Apply dressings. Put up pads around the bone and fix a bandage. In order to immobilize a fractured hand, use a triangular bandage to make a sling. This is possible if the casualty can sit or stand. Place a triangular bandage around the broken arm, take it to the shoulder around the neck and bind it with a reef knot. The sling will help to stop unnecessary movement of the hand, which will also avoid bleeding.
Any fracture of the limb can be very serious. If the leg is broken below the knee, there may be an open wound since there is little flesh below the skin. First, try to identify the damage. Apply soft padding. Press and put bandages. Look for any locally available materials like broken tree branches and bamboo pieces as support. Tie up using towel or kerchief and immobilize.
Be any part of the body, bleeding demands attention and should be controlled as soon as possible, especially if it is a head injury. Find out the nature of the wound, apply pressure with a pad till bleeding stops, place sterile dressings and secure it finally with a bandage.
In case of bleeding from the nose, ask the casualty to breathe through the mouth. Plug the nose with a cotton wool or plain cloth to stop bleeding. Pinch the nostrils and avoid blowing. Spit out fluid in the mouth.
Unlike serious bleeding and wounds, common bruises and cuts caused by sharp materials or by a fall are a daily happening. Such bruises can let germs in and cause infection. The affected area may be gently rinsed with cold water and soaps. Remove glass pieces or sand, dry the wound, apply medicine, put dressings and fix with an adhesive tape.